Hi, my name's Ross Wilkie. I'm the award lead for the Public Health degree at Keele University. What we're going to do in this video is talk about what you can do as a public health practitioner. And the aim of the Public Health degree at Keele is to provide some of the skills that might allow you to go on to become a public health practitioner once you complete the degree. So we've got Becky Procter here, who's going to tell us about how she got into public health and what some of the jobs are that she's done in the last 5 years that she's worked in public health as. So Becky is a senior public health intelligence and delivery officer, and she works in Stoke-on-Trent Public Health as part of the public health team there. So 5 years ago, you started in public health. Can you tell us about your first job?
Yeah, so I first worked in public health as an NHS provider, healthy lifestyle. So my first job was as a health trainer. So that involved working with people on a one-to-one basis or in groups, tackling any healthy lifestyle factors or things that they want to achieve, so whether that be increasing physical activity over to reducing alcohol consumption. It's also involved delivering sort of the NHS health checks that are delivered to people who are aged 40 to 74 to look for comorbidities or high-risk lifestyle factors that can contribute to high blood pressure or cancer in the future, and try and tackle those as a preventative approach. Another project that I've been involved in, again working for the NHS, was as a project manager looking at smoking in pregnancy. So again, working in public health, we always look at what the priority of a local population is. So at the time, for my job role as a project manager in smoking in pregnancy, there was a very high rate of pregnant women who smoked throughout their pregnancy. So the project involved looking at the statistics and engaging pregnant women, find the reasons why they smoke, what would help them to give up smoking whilst they are pregnant and after they've given birth as well. Also worked in workplace health and wellbeing, so it's working with businesses across the city to find out what their health and wellbeing needs are within their workforce and try and make the workforce a little bit healthier. And more recently, I work sort of in an intelligence role, so that again is more behind the scenes and looking at the data and the epidemiology of public health. So if you are interested in health promotion, those are sort of some of the roles that you can go into. There's lots of different varying public health roles, so from public sector, so working in the NHS or local authorities, to private sector or even voluntary sector as well, so working with some voluntary organisations to improve health and wellbeing.
So can you tell us a bit more about the projects that you're working on at the moment?
At the moment, obviously, now you might associate public health work with the recent COVID pandemic. So my job role at the moment is looking at sort of the data around COVID, working with partners and other organisations who've had various roles within the response to the pandemic. It's looking at the case data, how many positive cases are coming in each day, if there are any trends that can be identified, so sort of the demographics, the location, age ranges, places they've been to, as well as speaking to other people who've tested positive as part of the test and trace programme, just looking at how the virus may have spread between people. And the aim is to effectively control the outbreak quickly and efficiently.
I mean, you mentioned that you've come from a kind of sport background.
Yeah.
Is that part of the reason you got into public health, because of your kind of interest in sport?
Yeah, really, it's just my passion, really. So through sport, I'm also a fitness instructor as well outside of my day-to-day job. So I've got a huge passion in seeing how people can do physical activity and how it can benefit them physically and mentally. Just that passion's there that got me into public health, and it sort of draws on other sort of lifestyle factors that give me that passion as well to improve people's health and well-being.
So Becky, what advice would you give to anyone who is looking to start a career in public health?
I'd always advise people to get a bit of knowledge around public health. So completing a public health course will give you a basic knowledge around key skills and competencies that you would need to become a public health practitioner. So sort of doing a Bachelor of Science degree in public health, that would give you a platform to start working in public health in the future. Again, this would be combined with a work placement. It's very competitive out there, so combining the knowledge and a work placement will prove very valuable.
And that's what I think we're intending to do within the degree course. Essentially, we'll work with you guys at Stoke to develop projects students will be interested in. I guess most of them will be in health promotion, so how we can work to reduce conditions like cancer or cardiovascular disease, or even look at air pollution within the local population. Okay, great. Well, thanks very much, Becky. Thanks for your time today, and thanks for telling us about your role as a public health practitioner.